Mary goes to see her doctor about her recent breast cancer diagnosis. Dr. A tells Mary that there is a decision for her to make regarding two surgical options. Mary is still upset about her diagnosis and is having difficulty following the explanation between the two options. Veronica has also been diagnosed with breast cancer. Dr. B tells her that there are two surgical options. Her doctor rifles through a desk drawer to find a pamphlet that she uses to help explain this information to Veronica. She then sends her home with the pamphlet. The next day, Mary does not recall the details about the two options and feels confused about what to do. Meanwhile, Veronica refers to the pamphlet that was given to her and reflects on the benefits and risks of each option and how her personal values align with each of them. The pamphlet that Dr. B gave to Veronica is a patient decision aid. Patient decision aids, or PDAs, are tools that help patients take part in decision-making, especially when a choice has to be made based on the patient's preferences. They differ from patient education tools since they are intended to help patients participate in conversations about decisions with their clinicians, feel that their knowledge and preferences are well represented, and develop realistic expectations of risks and benefits. PDAs come in a variety of formats, both paper and electronic. They include leaflets, pamphlets, workbooks, videos, DVDs, websites, or interactive applications. The format of the decision aid may determine how and when it is used, either before, during, or after a clinical encounter. The Ontario government has committed to putting patients first, improving patients' healthcare experiences, and promoting patient-centered care using four objectives: access, connect, inform, protect. Patient-clinician encounters should therefore embrace the patient-centered care principles, which would lead to informed patient decisions and valuable health interventions. Although patient decision aids have proven results in helping patients acknowledge the decision, clearly identify the options, benefits, and risks, reflect upon their own values and preferences, and communicate with providers, they are not routinely used in practice. Clinicians have cited reasons such as uncertainty about the quality of available PDAs, indifference about their usefulness, time constraints, and concern about burdening patients with difficult decisions. The good news is that the use of PDAs is steadily increasing. The bad news is that there is not a practical way for physicians to share them with patients during a regular consultation. Introducing DECA, the web application that brings PDAs to the forefront of patient care. DECA offers clinicians PDAs specific to information that they enter into their patient's electronic medical record in real time. How does it work? DECA is comprised of a database of patient decision aids hosted on a cloud-based secure web server. Our inventory database retrieves PDAs from repositories by the Ottawa Hospital Research Institute and the Mayo Clinic. All the decision aids in the Ottawa Hospital Research Institute are scored against the 12 International Patient Decision Aid Standards criteria. These criteria were developed to assess PDAs on content, development, implementation, and evaluation. Based on the number of criteria that are fulfilled, DECA displays a score of high, medium, or low. When a clinician enters a diagnosis or treatment into a patient's electronic medical record, DECA will compare this data with the inventory database and report the matching patient decision aids based on associated ICD-10 and SNOMED codes. When the availability of one or more PDA is confirmed, a link will emerge on the right of the diagnosis or treatment field. To avoid workflow disruption, a pop-up will only appear if the clinician clicks the link. Clicking on the link displays the matching PDAs along with their publication or modification date, the author institutions, the compliance with standards label, and clinician and patient user feedback. With the click of a button, a clinician can open a PDA in a new tab in their browser, print it, or email it to their patient. After using a PDA, DECA will periodically ask the clinician to rate their experience with it. Patients are also asked to provide feedback on the PDA by answering targeted evaluation questions. If there is more than one PDA available, DECA will sort the list primarily by the recent usage of that specific healthcare professional, followed by the compliance with standards label, and finally by the publication or modification date. DECA does not probe, collect, store, retrieve, or track any data from the EMR apart from the codes in the treatment and diagnostic fields, as well as the log data from the user's interaction with the application. Data transmission between the EMR and DECA is secure and protected by a 256-bit encryption. DECA welcomes user feedback. To evaluate our software, we welcome clinician users to complete our evaluation survey. We also analyze user logs to track how clinicians are using DECA so we can continue to improve its functionality. DECA puts patient decision aids at the fingertips of clinicians, with a seamless and secure integration into the EMR, a trustworthy database of PDAs selected for the specific needs of the patient, a quality score based on the well-researched International Patient Decision Aid Standards criteria, feedback from clinician and patient users, and the ability to share PDAs with patients with the click of a button. Please contact us to see how DECA can help you continue putting patients first.